Dr. Martin, I constantly hear dentists talking about, when you get periodontal disease, when you get gum disease basically, which is slightly more than a gingivitis, meaning it's slightly more advanced. But anyway, so you get the gum disease, which starts off with a little bit of bleeding called gingivitis and goes into, pretty heavy rotten gums and things. Now all dentists almost I know keep talking about how bad it is to lose your teeth when that happens. And I'm sure it is bad, because we just talked, now you need to have expensive implants, crowns and bridges if you can. Either way it's expensive, and either way it's not good. Never mind, that your mouth probably stinks, it's rotten and all kinds of things while this is happening. But here's something else which I want you to talk about. While you lose your teeth, which may take 2, 3, maybe 10 or more years that you have this progressive gum disease going on, during that time, you have a disease. You have that yellow, ugly, reddish pus right in your mouth, right at the gateway of your blood vessels, and it poisons your body minute by minute. If you would have some kind of infection on your thumb, on your toe, and it gets a yellow little bud, you'll run to a doctor to try to cut it out right away. And in your mouth, apparently, you leave it in it, and it poisons your body. We know that people get kidney disease, liver disease, heart disease, strokes, babies get born underweight and premature, and all kinds of stuff happens. So wouldn't be that the much bigger problem compared to losing your teeth? Because at the very least, if you have money, and you correct me, at the very least, if you have money, you guys are doing good jobs with implants. You can make that mouth looking great. And you understand, but by the time you do that, I'm not so sure anybody can actually correct the liver, the thing, and all that type of shit which has happened, because you had an infection in your mouth. Am I totally off here?
Not really. I guess the thing is what periodontal disease is basically a warning sign that your body has deteriorated. And also it's suggesting that there are way more bacteria floating around in other parts of your body because of what your mouth will let in. If you don't take care of your gums around your teeth, then it's like an open gateway of bacteria to your system. And so it's going to have an impact on all your organs. It's going to be a delivery system for bacteria to the rest of your body.
Right.
So that's why it's so important to really get a grip of your oral environment and help clean it up so that you don't continue to flood your body with extra bacteria.
Because what happens is, if you flood your body with those extra bacteria, you have to have the good guys, the soldiers, the immune system soldiers, or whatever you want to call them, the antioxidants. They have to work there, and if they have to work on a very big area, somebody told me once, tell me whether that's true, that the gum infection is as big as your hand. Or can be as big as your hand. And nobody would run around with as big as a hand an infection anywhere on the body without going, oh my God. So anyway, if you have those soldiers needing to fix this, what about the next flu season coming along? Well, how many soldiers do you have left to fight that? It's like, if we have, soldiers in Afghanistan, in Iraq, well, what else do you want to do? Put some into Korea? How many more wars can we fight before we run out of soldiers, right?
That's a good point. That's true.
No more soldiers on standby. No more health police on standby.
That's true. That's true. Periodontal disease is basically it's like taking away some of the forces and keeping them totally occupied, as opposed to letting your body really be able to go in with all its strength and actually clean things up.
Right. And never mind that while that is happening, one does have a smelly mouth. One usually has a less self-confident level. There's just no doubt about it. We even with guys like us, but you see the latest. But with no doubt, all of us feel better when we dress a little better, when we're okay, when we get a pimple, when something happens, we don't feel that great. Do you understand?
Right.
So people and that of course must be resulting in a lowered level of economic production, of job, of whatever. And in a time like today, that again couldn't be good. It's just a twinkling spell. Never mind the thousands of dollars you have to spend to fix it, if you ever want to fix it. Yeah. So really, so you do agree that the infection happening over years until you lose tooth is probably more devastating to the body than the actual tooth loss, because at least they can be replaced.
Correct. That's true.
Dr. Martin, I appreciate you telling me.
Okay.